Let me try like.
Well, we can cut, right?
Yeah, we can cut. नमस्कार दोस्तों, स्वागत है आपकी एक और बेहतरीन वीडियो में फिर से आपके की खिदमत में। तो दोस्तों, जैसा कि मैंने आपको बताया कि मैं आज का दिन एक इन्फॉर्मेशन वीडियो शूट करने वाला हूँ। वो इन्फॉर्मेशन वीडियो काफ़ी ज़्यादा इंपॉर्टेंट है, स्पेशली इंटरनेशनल स्टूडेंट्स के लिए, क्योंकि जब भी हम एज ए इंटरनेशनल स्टूडेंट इफ़ वी गेट सिक वी फाइंड अ लॉट ऑफ डिफिकल्टीज टू सी अ प्रॉपर हेल्थ केयर। तो आज मैं अपने साथ हमारी क्लासमेट है, हर नेम इज शीना, एंड इनको लाया हूँ क्योंकि इनका काफ़ी ज़्यादा एक्सपीरियंस है इस चीज़ में, क्योंकि इनको पता है बहुत डिफरेंट वेज बाई विच वी कैन ईजिली सी द डॉक्टर, फाइंड आउट द बेस्ट मेडिसिन। और इनके बारे में थोड़ा बता दूँ तो ये एक मेडिकल ऑफिसर है। तो आज ये अपना एक्सपीरियंस शेयर करेंगे और हमें गाइड करेंगे कि हाउ वी विल गोना फाइंड बेस्ट possible treatment in Canada as an international student. So welcome, Sheena.
Thank you very much, Auntie.
So Sheena, I have some doubts in my mind. Like you have seen, like one of my friend Amitosh, he got sick, and we didn't find a proper healthcare here. So eventually, he has to go back to India for his proper treatment. So if you are in that situation, if you have some guidance from you, what you should suggest to us?
So firstly, I am not a medical officer here. I don't want them to think about it, to think of it that way. But I am a medical officer back in the Philippines. And my first program here in Fanshawe was Healthcare Administration and Management. So that's the reason why I know some things about the Canadian health system, but I am not an expert. Just a disclaimer. So I will be sharing just my experience of what I know and what I have experienced so far here in Canada. So for Amitosh is our classmate.
Yeah.
What happened to him? I think
He has some back issues, some spinal issues.
Was it an emergency? Did he slip or?
It happened all of a sudden. Like he was okay till 5 p.m. or 6 p.m. and he slept for a small nap, and eventually he was not able to wake up after that.
Not get up?
Yeah.
Because of pain?
Yeah, because of pain.
So, well, that can be considered as an emergency because it happened so suddenly and it was painful. So, he could go to the emergency room. Did
Yep.
he do it?
Yeah, we went to the emergency room twice. He
And
called
then?
911. That day we were in the class. He went alone to the
Okay.
hospital. But next time we went to the emergency ward. But we didn't get any proper treatment over there, and they were prescribing us just the painkillers.
Painkillers, and then what did they say about it?
Like they said, like the muscle pull.
Okay. So, I think before we tell your viewers what happens here in Canada if someone gets sick, can you just give like an overview of how it is if it happened in India?
Yeah, if it's happened in India, we have a private hospitals, we have a government hospitals, and if you have money, you can easily have the access to the doctors. You can easily have the access to the medicines, and we have small medical stores as well. So if you are having any sort of flu and all headache issues, so you can easily visit medical stores, the pharmacies. So you
Okay.
can get medicines easily over there without prescription. That's in
Okay.
India. And for
And
the
you can
hospital,
just
you can easily see the doctor if you have money.
any doctor.
Yeah, any doctor.
So that's the same thing with the in the Philippines. So if we get sick, it's up to us whose doctor or which doctor we're going to visit. So we have like the insurance system in the Philippines. So if the doctor is accredited with the insurance company, so you can go there and you can choose whoever you want. But here in Canada, so if you get sick, the first thing that you have to approach is your family physician. Now, this family physician, if you need more help, like a specialist, if he needs to refer you to somebody else, then that's the time he will request for it. But the first point of contact for any health condition would be your family physician. But as international students, we came here without family physicians.
Without family physician.
And the process for having a family physician is long because the wait list is long.
Oh.
So what he could have done was to consult here the Fowler Kennedy Clinic here in Fanshawe College. It's located at J Building.
Oh, like we didn't aware about that thing that we
Yeah.
can also consult. We have something in J building.
Yes, we do have it. So I knew about this because I searched for it in the internet, but I don't know because I have never attended any orientation session. So I didn't know about this. But then it's a sports medicine clinic
Okay. In Fanshawe College.
in
J
Fanshawe
building.
College at J Building, located near the gyms and
Okay.
all those things at J Building, the wellness center. But if your condition is not related to any sports or any trauma or any accident, you can still have an appointment there.
Okay.
So, for example, I went there because I had cough.
Oh.
And this cough, I was thinking maybe due to an allergy. But I wanted to be prescribed with a medication that's not over the counter. So I still went to Fowler Kennedy Clinic. I set an appointment. So it's like 1 week wait time.
Okay.
So I waited for 1 week, and then when I went there, I was met by like a physician assistant, doctor assistant, and he diagnosed me with allergies, and then he prescribed me with medications. So it's pretty easy. So Amitosh could have done that.
Yeah, we could have done that. But the thing is that back in our country, we don't have a system of like health insurance card that we have here. More care.
Okay.
That's totally new for us here. So we had
So
that more
everything
care.
is cash basis in your country?
Yeah, it's cash based.
So in the Philippines, we have health cards.
Okay.
But if you don't have any health cards, then you can pay in cash.
Okay.
But the thing is, we can choose any doctor. And we can go straight to any specialist if we want to. So for example, I'm having chest pain. And I think my condition is something related to the heart. So I can go straight to a cardiologist if I want to. It's not the same thing here in Canada. So everything, no matter what it is, you have to go to your family physician. Unless it's an emergency, then you have to go straight to the emergency room.
Here we have to take appointments. That is bit longer duration of appointments. For that time, we can't wait
Appointment for
the X-rays.
for the laboratory tests.
Yeah.
So that's the main thing that they talk. That's the main issue here in Canada. So yes, the health system is free. It's publicly funded, but the wait list is long.
Yeah.
So if you need like treatment or a diagnostic exam, then you would have to be on the wait list.
Yeah. So like
I haven't experienced that, but I know that that is the case because we have discussed that in class in my first program.
So what will be the charges to have a family doctor as a student, if I'm saying?
So the first thing is you should know that as international students, we are not eligible for OHIP or the Ontario Health Insurance Plan.
Okay.
That's why we have more care because all international students are required to be health insured during their study period. And so if you get sick, you can always just use your more care. And I think you can find a physician. You just I think there's a website where you can find your family physician.
Oh.
So for us, we already have our OHIP because my husband has a permanent job. So we were lucky to be eligible for OHIP. So after getting our OHIP, I contacted this website in Ontario that sets us up with a family physician. But it was a long process because we started doing this, I think, last July, and we only had our family physician this January.
Oh, this much of time?
Yes. So during all those time, whenever my kids get sick, we go to walk-in clinics.
Is it easy to approach
But it's
walk-in
not
clinic?
actually walk-in as in walk-in that you can just go there and be treated right away. These are called walk-ins, but because of the long wait list, then you have to come back.
Okay.
It's not really walk-in as in...
How much does they charge, the walk-in clinic?
They
Does they cover under more care, health insurance?
I'm not sure about more care, but it's covered in OHIP.
Okay, with OHIP.
But I think with more care as well, because it's also a health insurance. Like since you don't have OHIP, then you have more care.
Yeah.
I think you can use that for walk-ins and for any physicians if you wish to.
Okay.
complicated, like a complicated process.
Yeah, it's a complicated process, and we should know, we should be aware about these things, because we are here alone, and if we are not having a proper knowledge about this medical system,
Yeah.
so we might get in trouble for that. And we had experienced this with our
Yes.
friend.
And it's not just, it's not a matter of if you have money, you can get it faster
Yeah.
than the others, because that's what they're trying to avoid, that here to
Yeah.
become, that some services would become privatized. And so there would be like a sort of imbalance with those who can afford and those who cannot.
Yeah.
So everyone has to wait. Doesn't matter if you have money or pay for it, you have to wait.
Yeah, we have to wait for that. That's the issue. Anything else you can add in this, like that we are missing it?
Well, the laboratories are also covered with more care,
Okay.
because, well, this is not my situation, but I have a brother who's also studying in Fanshawe, so he has his more care. And then we noticed that his blood pressure is going high, so I asked him to schedule an appointment at Fowler Kennedy Clinic here at the main campus, because his campus is in downtown.
Yeah,
But I don't think they have the Fowler Kennedy over there. So he scheduled it here, and then after a week, he was seen by a doctor, and then the doctor requested for some laboratory exams, and it was covered with in more care.
Oh.
He didn't pay for anything. So even the medication, he paid for it upfront, but he can claim it in more care.
Yeah. Initially, we have to pay the
Yeah.
amount, and they refund it.
It depends. It depends. So for the medication, because we bought it in Shoppers Drug Mart,
Oh yeah.
I don't know if this is case-to-case basis with regards to the business, like the, they call this,
Like
the
as per I know,
pharmacy.
like when I went to Rexall, we have Rexall and Shoppers here, pharmacy store over here. So if doctor prescribes us some medicines, so we can visit over there and we can show them our prescription, and it covers under more care. So the medicines will be free, but they charged us some dollars.
Dispensing fee.
Yeah, some fees.
It's a dispensing fee for that you pay directly to the pharmacy itself. So it's not, so on top of your medication, you have to pay for the dispensing fee.
So yeah,
And that costs around $11.
$11. Yeah, that's not too much. Like,
Yes, but still.
Yeah.
Like we don't do this in the Philippines, so for whatever the cost of the drug is, that's what we just have to pay.
Oh, okay.
We don't pay for any dispensing fee. So that's new for me.
Yeah, that's totally new. Like they charge their own fees.
Yes. Yes.
Even the medicines are free under more care, but they charge their own fees.
And also with your more care, you can have like the full body like massage therapy.
Yeah, that
You
that
can
thing
have-
is new. If you are an international student, under your more care, you can have a free massage therapy. Please utilize this opportunity if you are an international student. If you have a more care health card, use that for your massage therapy if you need. So you can
Yes.
visit. That is totally free. That is a new thing for us. Even I get to know about 2 months back, like someone told me about that you can have a massage therapy that is totally free. So I was shocked.
Yeah.
So
I availed of it when I had my more care.
Yeah.
So if you have your more care, and for example your husband or your wife is already working and has a permanent job, so you already got your OHIP, you can already opt out of more care,
Okay.
and you will have a refund of around $600
Yeah.
for me. But I don't know if it varies.
yeah, but I didn't choose this to opt out. I'm also working. I also have a health coverage from my company as well, and also have a health coverage from
You
the
did
more
not
care.
opt out.
But I don't want to take any sort of a risk, so I just to go with both of the health insurance.
Yes.
Oh, yeah. So thank you so much for sharing your experience.
Yes. If you have any questions, just
It was valuable information that you shared to the viewers. And yes, and I can say that I wasn't aware about this information, and many more students are not aware about this information regarding the health system, how to approach easily, and what are different ways we can approach. So thank you so much for sharing your experience,
Sure.
sharing your knowledge,
Sure,
and helping many more students. So if you have any sort of doubt, you can just comment below the video. ठीक है, फिर मिलते हैं आपको नेक्स्ट वीडियो नेक्स्ट व्लॉग में. आई होप आपको ये इन्फॉर्मेशन वीडियो अच्छी लगी होगी, और इनके चैनल को पॉल स्टोरीज, इनको हम प्यार से पो मैम बोलते हैं, क्योंकि इनकी जो ऑडियंस है इनको प्यार से पो मैम बोलती है. एक और जस्ट लेट let my audience know what do you mean by po in Philippine.
Po is a courtesy word, po or opo. So it means a lot of,
Opo.
yeah, po or opo.
Yeah.
So po is a short version of opo,
Okay.
but it means yes. But that's used if you're talking to somebody who's older than you, or you just want to be polite because you don't know this person, or this is a person of authority. Something like
Okay.
that. Yeah.
तो आप लोग भी इनको प्यार से पो मैम बोल सकते हैं, मैं तो इनको पो मैम ही बोलता हूँ, तो प्यार से ही है। तो इनसे काफ़ी सीखने को काफ़ी कुछ मिलता है क्योंकि ये सीनियर है हमारे, काफ़ी ज़्यादा एक्सपीरियंस है, तो जिनसे जितना सीख लो उतना कम है। तो ठीक है, फिर मिलते हैं आपको नेक्स्ट वीडियो नेक्स्ट ब्लॉग में, और ऐसे ही हम इंफॉर्मेशन वीडियो लाते रहेंगे। बाय।